Here is my viewing audience for my informative and my persuasive speech. And now my Aunt Shell's going to tape it for me. The title of my informative speech is about breast cancer. Breast cancer is an uncontrolled growth of breast cells and occurs as a result of mutations or abnormal changes in the genes responsible for regulating growth. It is always caused by a genetic abnormality. Breast cancer is a serious condition and women should know their options. While doing my research, I found out a lot of information that I didn't know. My goal is to inform and educate you on the topic at hand so you can take the necessary steps to stay cancer-free. There are many different types of breast cancer, each affecting different areas of the breast. Some of the types of breast cancer are ductal carcinoma in situ, invasive ductal carcinoma, invasive lobular carcinoma, inflammatory breast cancer, lobular carcinoma in situ, and male breast cancer. Ductal carcinoma is the most common type of non-invasive breast cancer. Ductal means it starts inside of the milk duct. Carcinoma refers to cancer that begins in the skin or other tissues. It is called non-invasive because it hasn't spread beyond the milk duct. When you have this, you're at a higher risk for reoccurrence or developing a new breast cancer compared to someone who has never had breast cancer before. Invasive ductal carcinoma is the most common type of breast cancer. Invasive means that the cancer is spread to the surrounding tissues. It refers to cancer that has broken through the wall of the milk duct and spread to the surrounding tissues. Over time, it can spread to the lymph nodes or other areas of the body. Invasive lobular carcinoma is the second most common type of breast cancer. Lobular means that cancer began in the milk-producing lobules, which empty out the ducts that carry milk. It refers to cancer that has broken through the wall of the lobule and begun to invade the tissues of the breast. Inflammatory breast cancer is a rare and aggressive form of breast cancer. It starts with redness and swelling of the breast, not a distinct lump. It grows and spreads quickly, with symptoms worsening within days or hours. Lobular carcinoma in situ is an area of abnormal cell growth that increases a person's risk for developing invasive breast cancer later in life. Lobular carcinoma in situ is not a true breast cancer, but an indication that a person is at a higher than average risk for developing breast cancer. It is viewed as an uncommon condition because the number of people affected is unknown. Male breast cancer is a rare disease. Less than 1% of all breast cancer occurs in men. Sometimes men can develop real breast gland tissue because they take certain medications or have abnormal hormone levels, thus cancer can form. There are 8 different stages of breast cancer. Stage 0, where the cancer remains inside the breast duct. Stage 1, cancer is 2 centimeters or less and is confined to the breast. It hasn't spread to the lymph nodes. Stage 2A, no tumor can be found inside the breast, but cancer cells are found in the axillary lymph nodes, or the tumor is 2 centimeters or less and has spread to the axillary lymph nodes, or the tumor is larger than 2 centimeters but smaller than 5 and hasn't spread to the axillary lymph nodes. Stage 2B, the tumor is larger than 2 but smaller than 5 centimeters and has spread to the axillary lymph nodes, or the tumor is larger than 5 centimeters but hasn't spread to the axillary lymph nodes. Stage 3A, no tumor is found in the breast. Cancer is found in the axillary lymph nodes or in the lymph nodes close to the breastbone, or the tumor is any size and is spread to the axillary lymph nodes. Stage 3B, the tumor is any size and is spread to the chest wall and or skin of the breast and may have spread to the axillary lymph nodes. Stage 3C, there may be no sign of cancer in the breast or a tumor of any size and may have spread to the chest wall, and it is spread to the lymph nodes above or below the collarbone, and the cancer may have spread to the axillary lymph nodes or the lymph nodes near the breastbone. Stage 4, the cancer is spread to other parts of the body. There are symptoms that should be watched for, and there are many tests that can help detect or prevent breast cancer. There are symptoms that can be an early detection that a person may have breast cancer. A breast lump or thickening that feels different from surrounding tissue, changes in the size and or shape of the breast, changes to the skin over the breast, redness or pitting of the skin. To help diagnose or prevent breast cancer, a person can have one of these tests or screenings done. A mammogram, which is an x-ray of the breast, a breast ultrasound. This uses sound waves to produce images of deep structures within the body. It can be helpful in determining if there is a fluid-filled cyst or a breast tumor. An MRI, which uses magnet and radio waves to create pictures of the interior of the breast, or a biopsy, in which a sample of the suspicious breast cells is removed. If a person is diagnosed with breast cancer, there are many treatment options available to them. Breast cancer surgeries are common, and there are multiple options. A lumpectomy, which removes the cancerous tumor in a small area of the healthy tissue around the tumor. This is usually done with smaller tumors. A mastectomy, which the entire breast is removed. Sentinel node biopsy, in which one lymph node is removed. This is used when cancer is spread to the lymph nodes. The surgeon determines which lymph nodes near the tumor receives the drainage from the cancer. The node is then tested to determine if breast cancer cells are present. Axillary lymph node dissection, which several lymph nodes are removed. If cancer is found in the sentinel lymph node, then the surgeon will remove additional lymph nodes in the armpit. Knowing if the cancer has spread to the lymph nodes can help determine which treatment option will be best for the individual. Different types of therapy are also used to treat breast cancer. Radiation therapy, which uses high-powered beams of energy, such as X-rays, to kill cancer cells. Radiation therapy can also be administered by placing a radioactive material inside the body. Chemotherapy, which uses drugs to destroy cancer cells. If the cancer has a high chance of returning or spreading, doctors may recommend chemotherapy after surgery to decrease the chance of reoccurrence. It is also used in patients who have had the cancer spread to other parts of the body. It can try to control the cancer and decrease any symptoms that cancer is causing. Hormone therapy. This is often used to treat breast cancers that are sensitive to hormones. It can decrease the chance of the cancer returning. It may also shrink and control cancer that has already spread. Breast cancer is a serious condition and early detection is the key. Women should have regular mammograms and checkups in order to help prevent or detect the cancer early. Breast cancer is the second most commonly diagnosed cancer among women, and I feel that women should become better educated on the topic so that they know what their options are. I have a list of statistics I can just look at, pass it around. It's from breastcancer.org, and it's a list of the statistics surrounding breast cancer.
Red button.